I would like to share with you some information about what happened in the female body prior, during, and in postmenopausal life. The definition of menopause is the last menstrual period. All the time prior to the last menstrual period is called the perimenopausal. And after the last menstrual period is the postmenopausal. When a woman don't have period for 6 months is when she's menopause, and everything after that is the postmenopausal period. Some women can have what we call an early menopause. When she have her last menstrual period prior to the age 40, we call it early menopause. As you can see through the next picture, women have only certain amount of eggs in her body. She's born with about 7 million eggs, and by puberty, she have about 400,000 eggs. During her life, she's ovulating 1 egg every month, and by age of around 50, there will be no more eggs in her body, and when there are no more eggs in her body, she is menopause because there's no more ovarian activity and there is no more hormones coming from the ovary through the process of ovulation. Basically, there are a few hormones which are very important. Estrogen and progesterone are the 2 hormones that going through the female body cycles and coming from the ovary as a process of ovulation. And in menopause, there's no more ovarian activity. That is where estrogen and progesterone is going down, and FSH, which is the hormones coming from the pituitary, follicular stimulation hormones, is going up as a sign of no more ovarian activity. We can measure those hormones and see where is the hormonal status of the female and see how much ovarian activity she still have. And when we'll see that the estrogen is low and the follicular stimulation hormone, the FSH, is high, is where we will know that she is menopause from hormonal point of view. Most women, as you can see, will start to lose their estrogen even before menopause, as ovarian activity start to go down before menopause. That all this change and symptoms that happen in menopause can start to appear before menopause, and in matter of fact, in our experience in the Diamond Institute, 20% of our patients complain and being treated with hormone therapy due to menopausal changes and symptoms and even osteoporosis even before their last menstrual period, meaning before menopause. At which age menopause happen? As you can see to the next picture, usually menopause happen in the around age 50. Although in many women it will be before 50, usually between 45 to 50, and in some women it's going to be after the age of 50. Also important to notice that in about 10 to 15% of women, menopause will happen even before 40, which we called early menopause. Sometimes this is just a natural cause because there are no more ovarian activity. Sometimes it is because of some event in the female body that damaged the ovary, like endometriosis, and cut short the life and the activity of the ovary. Or sometimes it's because of surgical procedures where the ovary have to be removed for different condition like tumor of the ovary. When the hormones start to go down with menopause is where the women start to have or to feel symptoms. First, important to mention that not every woman has symptoms. Only about 70% of women will have symptoms, and about 30% of women have no symptoms at all. When we are talking about symptoms, there are early symptoms that will be immediately when the estrogen and the progesterone will go down. There are intermediate symptoms that will be 2 to 3 years later, and there are late symptoms which can happen 10 to 15 years later down into the postmenopausal year. The early symptoms are mainly the hot flashes, urinary symptoms, insomnia, emotional symptoms, irritability. All those things are common and happen in many different situations and in different strengths and this is individual thing which can differ from patient to patient. Later on, as the estrogen go more down and more years pass by, there will be other symptoms which come because of lack of estrogen in the body, mainly dryness of the vagina. The vagina may become narrow, make problem with intercourse, dyspareunia, and also urinary symptoms, as the lower part of the urinary tract is dependent on estrogen, and as estrogen will go down, then obviously we can have symptoms with the urinary tract. The later symptoms are osteoporosis and heart problem, which go up in scales during menopausal years. And I'd like to talk a little bit more about those later symptoms because they have clinical significance to human health, to life expectancy, and to morbidity. When we're talking about osteoporosis, the definition of osteoporosis is decreased mass per unit volume of bone. It will be easier to understand if we look on the picture of those two bones. On the right side, you can see a healthy bone, which is normal. On the left side, you can see a very thin bone, which lost a lot of its volume. Obviously, this thin bone, the osteoporotic bone, have tendency to break down, and those are the fractures that we can see in postmenopausal women. Every bone have a process of building and destruction. In menopausal years, as estrogen go down, the destruction continue, but there is less stimuli to build the bones which depend on estrogen. And that's why osteoporosis happened. You can see in the next pictures how a normal bone is compared to osteoporotic bone, and you see that even before there are big fractures, there is small fractures of the bone that when they become intense enough, the whole bone can be broken. When we are looking at osteoporosis, the nice way is to compare what happened with the male population and female population at same age group. And you can see that at around age 50, with menopause, there is a sharp drops in bone formation, and there is an increase in osteoporosis, and there is loss of bones with the female in compared to the male, that gradual decrease in bones through the years. These sharp drops happen around menopausal life is related to the drop in estrogen, and you can see from this slide that the drop in the bone happened even before menopause, as the estrogen start to go down before menopause. In parallel to the drop in the mass of the bone, there is increase in fractures that come with osteoporosis. And this is the mirror image of the previous pictures. You can see that there is very slow along the year increase in fracture in men, but very sharp increase in fracture with female around the menopausal year. And the most important area for fractures, or the most common area for fracture, are the wrist, the spine, and the hip. Fractures can be a very debilitated situation and can cause a lot of damage beside the fracture. We know, for example, that up to 20% of females may die as a result of hip fracture. This is not because the leg was broken, but this is mainly because when it's happened, then the woman is more attached to the bed, she's going to be more in bed, then she can develop more complications like pneumonia, urinary tract infection, and then can be late complication of hip fractures that can increase morbidity and mortality. How do we know what is the status of the bone? How we check osteoporosis? You can see a picture of the machine. This is one sample of machine which called bone densitometer. This machine uses minimal radiation, and the test, which take about half an hour, involve no pain. And with this test, we can measure the density of the bone in the spine and in the hip and in the total body. You can see in the next picture an examples of the result that come out of bone densitometry. And in this picture, you can see the graph of what's supposed to be the normal curve of bone density and what is the red zone, or what we call the fracture line. And when we measure bone density, we can see where is the current status of the bone, and we can use it as a tool for treatment, because when we treat, we may gain some bone back, and this machine helps us to know where we are at any specific time. What happens is that estrogen affects the liver and metabolism of different lipids in the liver. There are two types of lipid carrier. The good one, which is called HDL, high density lipoprotein, and the bad one, which is called LDL, low density lipoprotein. The bad one, or the bad cholesterol, carry the lipid inside the blood vessels and increase the risk for heart problem. The good one, the HDL, carry the lipid outside the blood vessels and reduce the risk for heart problem. With menopause, when there is less estrogen in the body, the good cholesterol is going down, and the bad cholesterol that carry the lipid into blood vessel is going up, and that's why there is increase in heart problem. Also, estrogen have some protecting effect on blood vessels, and as a result of that, there is increase in heart disease during menopausal life, and after the age of 50, heart condition with female become a major consideration for her health for future year. Thank you very much.